Hello and welcome to the program. I'm Teniola Shubowale. Our coverage of the coronavirus outbreak today begins in Morocco, where the health ministry has confirmed the country's first coronavirus case. The patient is a Moroccan man living in Italy, and he's receiving treatment at a hospital in Casablanca. Officials say his health condition is not critical. News of Morocco's first patient on Monday coincided with similar confirmations in Tunisia and Senegal. Tunisia's health minister, Abdelatif El Maki, told journalists on Monday that their patient was a 40-year-old Tunisian man who arrived in the country by boat from Italy on February 27. In Senegal, Health Minister Abdoulaye Diouf Sarr told a press conference that the patient is a French man who lives in Senegal and flew back from France on February 26th. The patient reported to a private hospital on February 27 with symptoms including a headache. Well, as the coronavirus spreads across Africa, the World Health Organization's regional director for the continent says she expects that all nations in sub-Saharan Africa will be able to test for the coronavirus within a couple of weeks. Dr. Matshidiso Moeti says the worst-case scenario would be if the virus spread rapidly to African cities with no facilities to contain and treat people. But she believes the continent's capacity to address COVID-19 is improving.
Health experts are concerned about the coronavirus outbreak in Africa, a region where health systems are already overburdened with cases of malaria, measles, Ebola and other infectious diseases. But the World Health Organization's African director believes that the continent's capacity to deal with the coronavirus outbreak is improving.
What I can say is that the capacity of countries to address this outbreak has improved extremely in the last few months while we've been working with countries. And even going back beyond that, before that, we've had an Ebola outbreak on the continent for a year and a half and have worked in countries generally to improve their preparedness. So point of entry, screening, for example, surveillance, laboratory capacity, and therefore we're able to build on this.
Dr. Matshidiso Moeti's comments came as Senegal confirmed its first coronavirus case, a French national living in the country. Senegal's case is the second in sub-Saharan Africa after an Italian man was confirmed to have the virus in Nigeria last week. North African countries, Morocco, Tunisia, Algeria and Egypt have also confirmed cases of the virus. Majority of the cases on the continent are linked to Europe, as opposed to China, where the outbreak began.
And this is at a time, in fact, when now the virus has spread out of China to 61 countries. And all of these, many of these have links, flights with tourism, businesses with African countries. So we're needing to review that risk categorization and see where we might have risk now, which we had not considered at the beginning of this outbreak.
Africa's Center for Disease Control and Prevention says it has activated its Emergency Operations Center for a continent where healthcare capacity is limited and early detection is vital. Countries across the continent have also introduced screening measures at airports. Kenya, Tanzania and Rwanda have suspended flights to China. As of March 2, 2020, there have been over 89,000 cases of the virus globally, the majority in China. Outside of China, it has spread to 66 countries with more than 8,800 cases and 130 deaths. Globally, the illness has killed over 3,000 people.
Meanwhile, in Nigeria, most states across the country are increasing their level of preparedness to identify an incidence of coronavirus. And health officials are giving assurances that emergency centers are being set up to isolate suspected cases. This report takes a look at what Bayelsa, Imo and Katsina states are doing to avoid the import of the virus.
More states across the country have joined in taking proactive measures to prevent the spread of coronavirus in Nigeria. In Bayelsa State, Governor Dwoye Diri is meeting with officials of the state's Ministry of Health, and officials say an isolation center has been set up at the Niger Delta Teaching Hospital, Okolobiri, for any possible case.
If there is anything we can still do to assist you The government is prepared to ensure the health and the safety of the citizens of Bayelsa.
It is also a busy time for the Imo State Ministry of Health officials, as it is, among other things, organizing a sensitization workshop on the prevention of an outbreak in the state.
At the entry points, all the roads leading to Owerri and Imo State, we have planted checkpoints where people are screened. And if for any reason any person is suspected, the nearest hospital there, the person is referred there for observation.
Meanwhile, in Katsina State, northwest Nigeria, the state government says it has activated an emergency operations center and training of health workers is ongoing.
We are leveraging on the same platform to ensure that we are ready for any eventuality of this nature. Anybody presenting with fever, cough, and difficulty in breathing, especially with history of traveling outside the country, should present to the nearest health facility for further assessment.
As awareness campaigns intensify, the authorities seem poised to ensure that residents are adequately sensitized and that all necessary steps are taken to prevent a spread of COVID-19.